You've probably seen them in restaurant windows, the letter grades, right? Health inspectors assign, showing us whether or not it is safe to grab a bite to eat. But a Spectrum News 1 investigation has uncovered that Los Angeles County is struggling to keep up on those inspections for thousands of high-risk restaurants. Renee Eng is leading us off with a closer look at what she discovered. Renee.
Good evening, Giselle. So every year, LA County is supposed to inspect those high-risk restaurants 3 times a year. And those are your typical full-service eateries that handle raw meat or seafood. But it turns out that isn't happening. And the county has been falling behind on this for several years. Take a look. After 27 years in the restaurant business, one thing that never gets old for Tricia LaBelle is catching up with her customers.
Talking to them, hearing about their day, hearing about their kids.
She owns the Bon Vivant restaurant in Atwater Village and heads the Greater Los Angeles Hospitality Association. Along with getting to know her diners, she keeps her health and safety top of mind. That means regularly facing LA County health inspections.
When the health inspectors show up, they're showing up at prime time. They're showing up right at lunchtime. So you've got your roll tops open in the kitchen. They're making a lot of food. They're getting food out.
LaBelle says she pays over $1,000 each year to the county's public health department, a mandatory fee for restaurant inspections.
99% of the time unannounced. You very rarely know coming. You can kind of guesstimate on it based on when they last visit you. It's generally every 6 months.
But according to LA County Department of Public Health internal documents shown to Spectrum News by inspectors, the majority of restaurants across the county aren't visited as often. The California Retail Food Code doesn't specify how many times a restaurant must be visited, but inspectors we spoke with say the health department aims to inspect high-risk restaurants 3 times a year as a best practice. Those are your typical full-service eateries that handle raw meat or seafood. Over the last year, county inspectors visited less than 1% of roughly 18,000 high-risk restaurants 3 times, and 8% never got an inspection at all.
When I opened it, I've always maintained an A. I've been visited aggressively, so when I hear that other restaurants aren't visited, that is rather disturbing.
The year before wasn't much better. From July 2022 to June 2023, the county only inspected 2% of high-risk eateries 3 times, and 12% never got a visit. Spectrum News spoke to a longtime LA County health inspector who asked us not to show his face, and we masked his voice. He says it's difficult to inspect high-risk restaurants even once a year because there isn't enough staff. So he's taking on the workload of 2 to 3 inspectors.
Previously, our goal was a fairly strong 70, maybe 80 inspections a month, and quite frankly, it's been going down maybe like 20%. I want to say 50, maybe 40 inspections a month.
He fears a lag in inspections can potentially lead to foodborne illness.
When we go and receive violations, and their excuse to us is that it's always been like that, it really shows us how long we have not shown up, how long it's been that they think that this is already a standard form of practice.
This issue first came to light in February after a restaurant inspector died by suicide.
Let's just take another moment of silence.
Which led to employees calling out workplace concerns. The department said it is working to address the issues, but inspectors we spoke to say things haven't improved in the past few months. The LA County Public Health Department told Spectrum News it has a 34% vacancy rate for field inspectors due to an industry-wide lack of qualified applicants. They currently have 160 on staff with 84 openings. The department also said, quote, like many employers and industries, public health has experienced increased vacancies since the beginning of the pandemic. These vacancies have impacted public health's ability to meet industry best practices, including inspecting high-risk facilities 3 times a year. We aim to inspect high-risk restaurants at least once a year and are working to ensure that goal is met. The county also says diners should feel confident that complaints that are received are immediately investigated. And I want to note that in analyzing the past few years of data of these inspections, the county is making strides in trying to make those 3 times a year inspections happen. Now, last year, for example, 8% of restaurants, they didn't get a visit at all. But the year before that, 12% didn't get an inspection. And the county right now is in a new fiscal year, so hopefully they will try to get better at visiting thousands of those restaurants the appropriate number of times.
Yeah, I mean, it's absolutely necessary, but why is there such a shortage?
So part of it is they have this huge vacancy rate. So it's 34% right now. So if we're looking at for every 10 jobs, 3 of those are empty. So that's a big problem. They have 160 or so people on staff. They are training about 24, but it takes time. Also, with the pandemic, there was a lot of resignations, a pause on hiring, and then also there are really strict requirements to become a health inspector. You have to have this 4-year college degree in a science background. You also have to pass this state exam. So it's not easy for anyone to do it, and to find the people that are qualified and then get them hired to go through the whole application process is quite lengthy.
But you also said that they're not just inspecting restaurants, they're also inspecting our pools and other things.
Exactly, and that's part of the workload issue as well, right? They have to inspect restaurants, buildings, pools, so they're responsible for a lot, which is good, but also they're not able to get to everything in time because there's just not enough of them right now.
Right, and you said that these restaurants still have to pay the county for these inspections, even if the inspections do not occur.
Exactly, yes. So
there?
that's something we're looking into as well. So the restaurants, based on the square footage, they're paying anywhere from $1,000 to over $2,700 a year. And this is a mandatory fee. So you got to pay this for the inspections. Ideally, you're supposed to be getting these 3 times a year if you're that high-risk restaurant that, let's say, handles raw meat or seafood. The thing is, if you're not getting these inspections, you still have to pay this fee. Where is this money going towards? And that's something that we are looking into and that the inspectors have brought up as well in our interviews with them.
We look forward to having you back, especially because when we go out to eat, we'd like to be safe and know that what we're ingesting is good for us. Thank you very much. Renee, I'm reporting.